Welcome all to the webinar on infection control in outpatient settings, dentist offices. Introduction of Scott Guertin, who is one of our healthcare market leaders for Fitzemeyer and Tocci. I'm Cheryl Butler, the Business Development Coordinator. A few comments before we start. We will all be in listen-only mode. If you wish to ask a question, please type in the side chat bar. The presentation will be about 20 to 25 minutes long with questions at the end. I will then present the questions to Scott for him to answer. This also will be recorded and the presentation will be forwarded to all attendees. Enjoy the webinar.
Okay, thank you, Cheryl. And thank you everyone for spending a couple minutes with me this afternoon. As Cheryl said, this webinar is on infection control in outpatient settings and specifically for dentist offices. So today I just want to speak specifically again to dentist offices and how we can create a safer environment while many practices are beginning to reopen after months of shutdown. So here at Fitzemeyer and Tocci, so we've received numerous calls from local dentist offices asking for our help in understanding the CDC guidelines on what specifically needs to be done with HVAC systems in order to comply with these recommendations. One client that we've been working with is Dr. Kathleen Keating out of Marshfield, Mass. She's been so helpful in all this, and she's granted us permission kind of to use her practice almost as a case study. So you'll hear me mention her practice and her name frequently throughout this webinar. So just to jump into this here, so the CDC, as I said, it provides the guidance for the dental settings during this COVID-19 response. Some of the key points to consider are that dental settings are very unique and they require, they warrant specific infection control considerations, especially since they're in the mouths, they're in people's mouths doing work every day. Dentists need to consider who to provide treatment to and focus on the most critical services. The one important thing is that they need to communicate with personnel and patients, basically the need to stay home if they're sick and how to handle a situation if somebody with COVID-19 enters the facility. So I want to discuss the background on COVID-19 a little bit. SARS-CoV-2 is the actual virus that causes COVID-19. It spreads between people that are in close contact with one another, usually within 6 feet. So, when an infected person coughs, sneezes, or even talks, the virus persists in aerosols for hours, on some surfaces for days under lab conditions. The chart to the right shows how long the viruses can persist on various surfaces. Excuse me. So you can see, on some stainless steel or plastic surfaces, it can last for 2 to 3 days sometimes. The virus spreads, can also spread from people not even showing symptoms, which is the real scary part about this virus. So these are the CDC general recommendations that dentist offices should follow as a protocol. The CDC leaves it basically up to the dental healthcare personnel to decide when to resume non-emergency dental healthcare based on framework outlined on the CDC website. So dentists would more likely provide care for any dental emergencies such as a crown falling off, or in my case, I'm a hockey player, so if I get a stick or a puck in the mouth, then obviously that would constitute a dental emergency where a dentist should provide service. Dentists would unlikely provide care for, like teeth whitening procedures or general cleanings. It's advised to kind of prolong or push those appointments off as long as possible. Dentists should monitor trends in COVID-19 cases. Local cases as far as in deaths as well, they need to monitor those trends. They should screen patients for any fever or symptoms of COVID-19 prior to them entering the facility. And they should also ensure proper PPE is worn by all staff, as well as patients coming in, such as masks. One thing that the CDC does recommend is that all dental healthcare personnel should wear surgical masks. They shouldn't be just wearing cloth masks. It just provides a little bit more protection for them. So the dental, these are some of the physical recommendations that the CDC has put forth, which again are pretty typical of any business reopening at these times. You know, ensure proper cough etiquette. You know, they should be posting visual alerts, posters about hand hygiene and cough etiquette. They should have alcohol-based hand sanitizer for patients, and staff to use. As the picture shows, install some kind of plexiglass barrier at the reception desk to prevent that cross-contamination when speaking. And, minimize the amount of people that's in the waiting rooms. We want to keep approximately 6 feet apart, any chairs. And ideally, to be honest, I know most of these dentist offices are now saying just wait in your car until someone can come let you in. The least amount of people in the space, the better. As these facilities are reopening. Okay, so HVAC considerations. Now this is where we can help, quite frankly. So unfortunately, the CDC does not provide any specific guidance on decontamination of building HVAC systems that are potentially exposed to the coronavirus. They do provide, physical or other type of air movement recommendations for the HVAC system. And what they want you to do is design a system that provides air from a clean space to a less clean space. So this means delivering the cleaner supply air to the reception area, staff work areas, corridor spaces, and returning air from less clean spaces such as patient operatories, treatment rooms, waiting rooms. They want you to increase the filtration on the central system to as high as possible without negatively affecting the airflow or capacity of the system. So the higher the filter efficiency, obviously the more restrictive the filter will be, which could impact the airflow supplied to the space. Unfortunately, many dentist offices that I visited, they have light commercial or even residential style systems, HVAC systems, that simply cannot overcome, a high efficiency, MERV 13 filter. It would just restrict the supply air to the space to a point where it would start affecting, heating and cooling capacities of the space. So you got to be careful of that. They recommend increasing the amount of outdoor air to the HVAC system if possible. In the case of Dr. Keating's dental practice, she has 2 small residential style systems, and neither system has any outdoor air being delivered to it today. So they simply rely on operable windows, to meet the ventilation code. We considered, as part of that project, adding some ductwork, some exterior louvers to bring in some outdoor air. However, we found out through calculations that the system could only handle a small amount of outdoor air, and the cost to install all of that was just so high that it from not a payback standpoint, but it just didn't make a lot of sense to kind of go down that road. There were other options that we recommended instead, which we feel can provide more bang for the buck. The CDC says to limit the use of demand-controlled ventilation. So what that means is, in order to increase the HVAC system efficiencies, the building code allows us to reduce the amount of outdoor air that's being supplied to any space. As long as you're measuring the carbon dioxide levels in the space, you can reduce the amount of outdoor air being brought into the system, which therefore, saves operating costs on the system. However, in the world of coronavirus, the opposite is really recommended. It's preferred to flush out the space with as much outdoor air as possible. And they also recommend that you run the bathroom exhaust fans continuously, which again, try to flush out that space. So if there is any virus floating around in the space, the hopes of being able to extract that and dump it outside, that's the goal, and then make it up with some fresh air from outdoors. So patient placement and air movement. This is a tough one. It's all good if if we're designing a new space from scratch today. However, many dentist offices are going to struggle to comply with these recommendations. Dental treatment rooms is what they're saying is dental treatment rooms should be provided in individual rooms. And again, the majority of offices I've visited did have individual rooms for the treatment rooms. However, I have seen, and I've even designed spaces kind of in more of a commercial or more of in a hospital setting, I guess, but where there were open treatment chairs, but they say you're supposed to be separated at least 6 feet between the chairs with physical barriers separating them. Operatories should be parallel to the direction of airflow. This is often not the case, and you can kind of see in the photo to the right. That's another example. The patient, they want you to place, the CDC is recommending that you place the patient head near the return vents, away from pedestrian corridors and towards the rear wall. So typical treatment rooms that I've been in, and you can see to the right here is a floor plan of Dr. Keating's office space, or her dental office space. And this seems to represent, even my own dentist. It's the same kind of setup here where the patient head is away from the outside wall, kind of closest to the door. And, you're facing the outside wall, looking out the window. And, in order to rotate this to comply with the CDC requirements, you can imagine trying to rotate the chair, rotate all the equipment. It would just be, it would be very costly. So I can see this with new systems designing it this way, but for existing systems, we kind of have to make some adjustments to the design here. So with this layout, you can see the way Dr. Keating's office is set up is she's got the supply grills along the exterior wall, and then there's a common return grill in the corridor just outside each room. And with this layout, what's happening is the clean supply comes out of at the exterior. It's drawing the clean air across the patient, and it's drawing that. Now, once it gets contaminated from the patient's mouth, it's drawing that contaminated air right across the dentist's breathing zone, and then back to the return grill, which is just it's a bad design. So, we need to correct that situation. So at Dr. Keating's dental practice, what we're recommending is actually capping the return grills in the corridor and providing new return grills in each of those treatment rooms. She has 4 treatment rooms altogether. These are just 2 of them. But what that will allow us to do is to pull the air from, over to kind of away from the patient and away from the dentist. In her case, we're also having to relocate many of the supply grills. And what we're trying to do is put the supply grills over by the patient's head, so that, again, the clean air comes out near the patient's head and gets drawn across the patient, clean air, and pulled from the patient's head down to their toes, and then gets returned back to the HVAC system. So portable HEPA filters. This is a recommendation of the CDC. These are sometimes called air purifiers. The CDC states to consider the use of portable HEPA filters while patients are undergoing and immediately following an aerosol generating procedure. So what is a HEPA filter? This seems to be a question that's popping up more and more to us. So HEPA stands for high efficiency particulate air, which filters out 99.97% of particles at 0.3 microns or larger. The coronavirus itself is 0.125 microns in its finest form, by itself. So you might ask, won't that 0.125 go through a HEPA filter? And the answer is yes, it is possible at its finest forms. However, the viruses are generally attached to water droplets. When people speak, they sneeze, they cough, which is especially true in a dental setting. So the majority of this stuff will be captured by the HEPA filter. And also, just the virus itself, even though it is smaller than some openings through the HEPA, it could still just hit the media and get collected on the filter. So most of it will be captured. There is one step above a HEPA filter, and that's called an ULPA, a ULPA, which is an ultra low particulate air filter. This is going to capture 99.99% of particles at 0.12 microns or larger. So that's smaller than the coronavirus. Therefore, again, in its finest form, you know, it will catch everything. The problem with the ULPA filter is it's very restrictive, and it can really reduce the amount of air delivery to the space. So you have to consider the options when you're selecting this equipment. The CDC says to select these HEPA filters based on clean air delivery rate, which is a little bit of a different term than engineers are used to using. You know, we've historically used air changes in these rooms, but they want us to base everything based on clean air delivery rate. There are two factors that influence the ratings. There's filter efficiency and filter airflow. So for example, if an air purifier produces 100 CFM and the filter can remove 90% of the particles, then the clean air delivery rate is 90, which is 100 times 0.9. According to AHAM, which is the organization, it's Association of Home Appliance Manufacturers that came up with this clean air delivery rate term, they suggest that you take the CADR rating and multiply it by 1.55 to get the approximate room size, you know, based on 8-foot ceilings that, you know, that this air purifier will clean. So if you take the 90 CADR times 1.55, that gives you a 140 square foot room that unit can clean. So the higher the clean air delivery rate, the higher the air change rate, it just increases the effectiveness and the turnover rate of, you know, in between patients of that room. And then location of the HEPA filter is also important. You know, they want it to be near the patient's chair, but not behind the dentist. Again, you don't want to be drawing any dirty air across the dentist, across their breathing zone. All right, you can go on to the next slide. Okay, so portable HEPA filters. Here's a few examples. The unit on the left, this is called an Extractol dental clean air unit. It's being marketed especially for dentist offices. And you can see on the top left, you can see the arm. It's got an arm that can come around and it can capture any contaminants coming out of a patient's mouth while the dentist is working. And then it pulls it through. The HEPA filter is located in the box, and there's a fan and a filter in that box. And then it, you know, just kind of recirculates back to the room. This is a great option, you know, for dentist offices. And, you know, it's not too bad. I think the price is listed on their website. It's about $18.95, so not too bad. Dr. Keating was using some other device. She's trying to do something inside the mouth so that it creates a negative, like a suction in the mouth, so that no particulates are coming out of the mouth at all. So we opted not to go with this because I didn't want to be fighting what she was trying to provide in the mouth. So in her practice, we ended up going with that Health Mate in the top right-hand corner. Excuse me. The Health Mate is a small little unit. It's priced right. It's about $725, I believe. And that will provide about 400 CFM on high speed. So again, the clean air delivery rate on that unit, because it's a HEPA, is almost 400 CADR, which is a pretty good size unit. I think it can do like a 600 square foot room based on that number. So that's pretty reasonable. The unit on the lower right is called an Invarco HospiGuard unit. So this can create like a negative pressure room, like an isolation room. It's got a HEPA filter. It also comes in an ULPA filter, an ultra low particulate air filter. But that's more for, you know, either a bigger space with multiple chairs, or it just provides up to 800 CFM, I believe. So a lot more air changes with that unit. And that's a lot more expensive. I think that system's about $6,000. So, but wanted to share some options here. So the CDC recommends the use of upper room UVGI, which is ultraviolet germicidal irradiation. And they recommend this as a supplement to the the items just mentioned, previously. So the link below is it's a link to the CDC. They have a whole, it's like an 85-page brochure on how to design, how to locate the upper room UVGI systems. I could do a whole separate webinar on that, but certainly check out that link, check out that website. It's I don't know if you can pull that up, Cheryl. If not, it's not a big deal, but it's definitely something to reference if you need to design those rooms. So while I was referencing UV systems, I was introduced to this Puro lighting, which really impressed. Unlike other systems, Puro lighting uses a broadband spectrum of UV lighting. So it combines the germicidal bands of UVC and UVB, as well as the antibacterial band of UVA, to optimize the germ killing efficiency of this product. It's really interesting. The fixtures come in many different types of portable units, as you can see to the right. Based on your room size, you can get these with a single lamp, a dual lamp. You can get lamps on back-to-back sides. So they're very helpful in helping select these units and install these. Now the fixture on the top left, you can also buy these with a lamp, that can get installed. It's just almost like a light fixture. It gets installed on like a 2x2 ceiling grid or a 2x4 grid, I believe, and you can get these up in the ceiling and basically operate it. You can either operate it off of a switch or you can operate it off the BMS system. You can time it so that at the end of the day, when everybody goes home or at night, these things go off and disinfect the room. Or you can operate it manually with a light switch. So when a patient is complete, had their service, they leave the room, you can turn on. If you can close the door, these fixtures are intended to operate with nobody in the room. So if you have a door to your room, you can close the door, turn the light on, and it will disinfect the room within about 15 or 20 minutes. So it's a great option to consider between patients, as long as you can close that door off. So humidification, interestingly enough, humidification was not specifically referenced in the CDC guidelines as I was reading through it, but I believe this is a really, really important and simple HVAC supplement that all healthcare spaces should really contain. There's been numerous studies that have been performed that prove the results of really good space humidification and dehumidification for that matter. But for today, I'm going to focus more on the humidification side. This is one study that took place in a hospital where over 8 million room data points were collected for about 300 patients. And you can see in the graph that as the patient room RH went down, that the infections went up. So the blue line, is the RH, and you can see when it reached 40%, the infections are really dropping off. Okay, next slide. Yep. Here's another study in a long-term care facility where the infection rates were the lowest at, between 40 and 60% RH. So the orange line is the respiratory, bacterial and viral infections, and it kind of bottoms out right around 45% RH. So again, that sweet spot is 40 to 60%. If you can, you can see if you don't have any humidification in your space, you're to the left of that blue zone, the infections really jump. So again, I really recommend the humidification. Another slide here on influenza. You can see the infections rise greatly when the RH is below 40% RH. So it's not only coronavirus, but all viruses like this. The infection rates just prove to be much higher at a lower RH in the space. This is another interesting statement here about coronavirus exactly. So humidification to 50% RH reduces the viable coronavirus to less than 1% in 2 days. So it significantly decreases the infection risk when you, again, humidification. I'm driving home this point, but I think it's important, and I'm really interested why it's not more recommended in the CDC guidelines. Here's a chart out of ASHRAE, and this chart basically, again, same idea, right? Between 40 and 60%, you can see that sweet spot where, you know, bacteria doesn't grow, it can't be sustained. Viruses, again, you can see the second kind of triangle down is the virus, and you know, again, it stops growing or stops living at about 45% RH. You know, you don't want to go too high with the humidification because you can see things come back at the higher end of that range, but again, 40 to 60% seems to be that sweet spot. And that's one of the recommendations we're doing with Dr. Keating is we're putting in, you know, a small humidifier, a little steam humidifier in her system, and we're confident that's going to be just healthier in general for her space. So just in conclusion, you know, dental healthcare personnel, they're confused as to what to do since, you know, they're not trained in HVAC. The CDC recommendations, these things are being updated along with the phased openings of many different states. So every time, you know, there's another phased opening, they're coming out with new recommendations, and so it's causing a lot of confusion in the dental world. Many dentists, you know, their systems, their HVAC systems just can't comply with some of these recommendations just because they're more residential style, and, you know, without remodeling or replacing units, they could incur a lot of costs. So there are some ways to improve the risk, improve efficiencies, and that's by, you know, supplementing with some of these portable HEPA filters, some UV lighting, humidity, and then I just said, don't forget about humidification. You know, that's really, really important in these spaces. And, you know, finally, you know, we're here to help. If anybody knows of not only dentists, but anybody who's in these types of settings that are kind of pulling their hair out, you know, this is what we do, right? So we're here to help. We're here to provide any kind of direction that we can provide. So don't be afraid to call. So questions, Cheryl, do you take this or?
Yes. So I do have a couple questions. One of them is, would a recirculating ceiling mounted fan HEPA module similar to a clean room be useful in the dental exam room?
Yes, I think anytime you can increase air changes in the space, you know, with a HEPA filter, it doesn't need to be on the floor. It could be in the ceilings, you know, anywhere in the space will definitely help. Again, it'll help change the air. And every time you're changing the air over in that room, you're cleaning the air, and it's going to catch any viruses or bacteria or whatever else is in that airstream, and it'll collect onto the filter. So it will clean the air. And again, it reduces that turnover time. So instead of letting things settle down on their own, you know, you're kind of changing the air, you're making it, you're collecting it, you're cleaning it. And, you know, that way when the next patient comes in, it should be a cleaner space.
Okay, thank you. Another one, will these recommendations change your design approach for new dental clinics?
Yes, most definitely. I mean, you know, we're going to try to work in as many of these recommendations as possible on future projects. You know, seeing that these are out there now, and not only that, but with coronavirus in general, I mean, I think it's going to change everybody's design on HVAC systems moving forward.
And one more, does COVID-19 present new or different challenges that you have not seen before in the HVAC design?
Yes, it presents it actually presents opportunities is the way I kind of see it. Is it presents opportunities to use technology that, quite frankly, gets value engineered out of most projects. You know, I mean, UV lighting has been around a long time, you know, and we can put that in some air handling units, humidification, you know, provisions for HEPA filtration in the main units. I mean, these things are always there, and you know, as engineers, you know, we always want to belts and suspenders, everything, right? We want to make sure that everything is in there, but a lot of times cost is a factor. So what I think what we're going to see moving forward is that these things are going to stay in projects now. The people are going to want to be safe, and they're going to want to know that they're safer. So I think we're going to see a lot of those systems kind of coming back, and people are going to definitely opt to install those now versus saving a few bucks.
Great. That's what I've got, Scott. Thank you very much. And thank you all.
Thank you.